Afternoon, the Select Subcommittee on the Coronavirus Pandemic will come to order. I want to welcome everyone. Thank you for being here. Without objection, the chair may declare a recess at any time, and it looks like we will need to go back to votes. After votes, we will return, however. So I now recognize myself for the purpose of making an opening statement. When the first COVID-19 vaccinations were administered in December 2020, it brought about a feeling of hope in a very dark and scary time for our country. There was a sense that this was a great opportunity to get the country back on track, and I shared this optimism. I hoped the vaccine would allow our lives to return to normal, or normal as we may know it. As a physician, I administered hundreds of COVID-19 vaccinations in Ohio in the early months of 2021, received the vaccine myself. Unfortunately, the rollout of the COVID-19 vaccine will be forever tarnished by the administration's decision to remove the doctor from the doctor-patient or patient-doctor relationship and force COVID vaccines upon everyday Americans, the armed forces, and the federal workforce. Despite repeatedly promising that they would not, the Biden administration decided to use the power of the executive to impose mandatory COVID-19 vaccination on tens of millions of Americans. A decision that tarnished trust in public health officials, and for many actually may have led to vaccine hesitancy. And we've heard that. Americans don't do well when we simply say, "because I said so." Americans want to be educated, not indoctrinated. That's just who we are. Sadly, one of the most impacted sectors was our healthcare workforce. It's impossible to overstate the horrible irony that the very same people who were heralded as heroes in 2020 were so quickly cast aside, contributing to a crisis level of shortages across the country when it comes to healthcare workers. And these were medically educated, compassionate, and medically concerned professionals. This was bad policy with a bad approach. But it wasn't just healthcare workers. Between the administration's 5 major vaccine mandates and the private sector mandates that followed, it became a choice for many Americans. Get vaccinated with or without medical consultation, or lose your livelihood. Something our witness, Ms. Williams, is all too familiar with. Many people had very reasonable concerns about whether the vaccine made the most sense for them. They asked questions like, what if I've already had COVID? Will it affect my unborn baby? Am I at elevated risk of adverse effects? What are the long-term side effects? Many we couldn't answer. I would contend that the COVID-19 vaccine saved perhaps hundreds of thousands of lives, especially amongst the most vulnerable, and especially in the short term for the most vulnerable. These discussions should have been between a patient and their doctor, but instead the Biden administration inserted itself and defiled the sacred relationship that we as Americans have always treasured between the doctor and the patient, who knows you, understands you. But there was no discussion with the doctor that you know and trust. For the government, it was because I said so. It was supposed to be good enough. Hardly bedside manner. No discussion on side effects, who is at risk, treatment options, etc. Worse still, the vaccine did not prevent the spread of the virus, a fact already evident by the time the mandates were imposed. Actually, we know from the trials that even vaccinated patients could get COVID. No matter how much President Biden or others claimed or wished that the vaccine stopped the spread of the virus, the science didn't support it. And if the vaccine does not prevent you from getting sick, then what is the utility in forcing you to get vaccinated? That's a question many people asked. It's a legitimate question that they can have a conversation with their doctor. What are the pluses? What are the minuses? How great a risk am I? What the vaccines did do was significantly reduce the individual's chances of hospitalization or death. I think that's inarguable, and the trials showed that. Again, because they did not stop transmissions, this was a choice that should have been made between each person and their doctor. To me, one of the most tragic consequences of these mandates is the distrust that it sowed in vaccines more broadly. Vaccines that we have relied on for public health for decades were now in question because of the way this was handled, the messaging that went out. In his paper, The Unintended Consequences of COVID-19 Vaccine Policy, our witness, Dr. Badash, argues that the government's aggressive and inflexible COVID-19 vaccine mandates are a case study in how not to uphold ethical norms and trust in institutions. And Dr. Badash, as I read through your paper, I see the comments from leaders around the world, not scientific leaders necessarily, not medical doctors, but from politicians. Not one of them thought it would be a good idea to educate the people that they lead on what was going on with the vaccine. Not one. Thank you for pointing that out. So this is important. Further, not only did these mandates damage Americans' trust in public health and in vaccines and cause people to lose their jobs, they also negatively affected our military. A good friend of mine, a physician no less, battling breast cancer, was unfairly harmed by the Department of Defense's vaccine mandate. Her oncologist advised against the vaccine for medical concerns. She was pro-vaccine, but her oncologist advised, hold off. Stay as safe as you can. Her career was negatively affected as a result, putting it mildly. Because of the mandate, she sought a medical exemption to temporarily delay getting the COVID-19 vaccine until she finished with chemotherapy. This seems to be a perfectly reasonable request from her provider, but apparently the Navy didn't think so. And while the review board, after much legal wrangling, voted to retain her in the Navy, they also substantiated that she committed misconduct for refusing the vaccine. And that's on her record. That black mark on her record has likely hindered her from a well-deserved promotion. I know, I worked with her. She wanted to be vaccinated. She did all the right things, and she was still harmed by this mandate. Besides what may be right or wrong in this case, our military recruitment and retention has been negatively affected. It's harmful for our nation. As someone who recently retired from the service, this is highly concerning. This hearing is an opportunity to conduct an after-action review of the COVID-19 vaccine mandates. And as the ranking member has requested, help us prepare for future pandemics by evaluating the policies that have been put in place. So I look forward to an on-topic discussion today, and I would now like to recognize Ranking Member Ruiz for the purpose of making an opening statement.